Cardiovascular disease is the leading cause of death in both men and women. Each year, more than 1 million people suffer from a heart attack. 500,000 people die. Half of them die suddenly. I'm joined today by one of my patients, Carol Stedman, who's here to share her heart attack experience. Carol, thanks for coming.
Thank you for having me.
The first time we met each other was in the emergency room at St. Joseph's
Yes,
Hospital.
it was.
And you were actually having a heart attack, and you didn't know it.
That's right.
I knew it, because I had an EKG in front of me. What were your symptoms? Can you tell us?
For a couple of months, I'd had a sore throat, only when I went to my regular doctor, I couldn't explain it. It was like heartburn, only not. I had a heavy chest. My stomach was very upset. And it seemed like the minute that I told you, and my back, you had me in the room and you were telling me I was having a heart attack.
Yeah, and what's so different about you? Most people think a heart attack is a crushing chest pain going down both arms. Sometimes in women it's a little different. Sometimes it can be an indigestion sensation, and sometimes it could be a tightness in the throat or the jaw, sometimes a little nausea.
Yeah.
So you had symptoms that were not the typical man-crushing type symptoms. I was fortunate in that we had an EKG which showed the classical type of heart attack. And what was going on with your heart was that one of your arteries was totally blocked. And on this heart demonstration, your heart has 3 arteries, one down the front, and you have one that supplies the bottom of the heart and one on the bottom. And this artery here was totally blocked, and I put a stent in it. And we're going to show this whole reenactment. But the stent's just like a little coil that goes in through the legs, and I put into this artery and open the artery up. We're going to take you to the hospital now and do a reenactment of your experience.
But it's only a reenactment, right?
Only one heart attack at a time.
Okay.
Right now we're in front of St. Joseph's Hospital, and we're going to have an exciting segment, a reenactment of an acute heart attack. One of my patients, Carol Stedman, came here and we treated her with a balloon angioplasty and a stent. My wife, Rena Santora, is a registered nurse. She's going to take us through a step-by-step process for treating acute heart attacks right here at St. Joseph's Hospital right now.
The state-of-the-art treatment of heart attacks starts with 911. When you pick up a patient having a heart attack, what happens before they arrive?
As paramedics, when we get on scene, we're going to do a primary and a secondary survey, which means that we're going to ask the patient a series of questions to determine what exactly is going on. Once we determine the patient is having chest pain, we have a series of questions that we ask to help alleviate the pain with medications and IV therapy. We'll also give the patient oxygen and transport the patient to the hospital. During that time, we're talking to the hospital via radio, and we are communicating the patient's status, if it's changing or getting better, so that when we get here to the hospital, they can take care of the patient.
The modern treatment of an acute heart attack is opening the artery as quickly as possible. We call this door to balloon time. What that means is by the time you hit the emergency room door and we do an EKG and it identifies you as having a heart attack, we move you quickly into the catheterization lab, where we take pictures of those blocked arteries, and then we put a balloon into that blocked artery and open it within 90 minutes. That is our goal, a door to balloon time of 90 minutes. This has shown to save lives, preserve heart muscle, and get you back to a normal life as quickly as possible.
When I got to the hospital, my throat hurt, and it's not a sore throat, it's a kind of a burning indigestion. I had a heavy chest, I was very nauseated, and my back ached. And it was when I said my back ached that everybody seemed to right then realized it might be a heart attack, I guess.
Hi, my name's Liz. I'm the manager of the Chest Pain Center here at St. Joe's ER.
Liz, hi. Looks like things are happening quickly. What's happening now?
Well, we've been in constant communication with the paramedics. They've already notified us that we are receiving an acute heart attack, and right now we're in the process of reconfirming that she's in fact having a heart attack.
You have any chest pain right now?
Can I pull this?
No, I never did have chest pain. I just had a bunch of other things.
What kind of things?
My throat, it wasn't like a sore throat, it was like indigestion, and my chest was heavy, and I was nauseated, and my back aches.
Our goal is to get this patient to the cath lab as quick as possible. When the patient hits the door of the ER, that's our door time. when we are able to open up that occluded artery in the heart, that is our balloon time. And the quicker we are able to open that up, the more muscle we save. And so that's where we get the motto, time is muscle.
Do you have a history of any heart problems?
No.
Okay. How do you feel right now? What do you feel right now?
Weak.
Well, I'm Nathan. I'm the chest pain nurse. We're going to go work really quick with you, get an EKG, and find out what's going on, okay?
Liz, what's happening now?
Well, once the ER physician confirms that we do have an acute heart attack, then a whole slew of things happen. First, we call a code STEMI that alerts the key players in the hospital that we have an acute heart attack in the emergency department. We do a quick history and physical that's taken by the ER physician as well as the nurse. We want to ask her about pain, where, when, and how bad it might be. We want to also control pain by giving her some medication. We'll start her on some IV intravenous blood thinners. We'll start her on heart medication like beta blockers. We want to make sure that she has aspirin on board. Oftentimes it's given by the paramedics, but we also want to make sure that it has been done. We are also monitoring her heart rhythm, her heart rate, her blood pressure, and how well she's breathing continuously.
Hello, how you doing? Dr. Gold. Let's take a listen to you, okay? You feeling all right?
No. What's happening now?
Well, the ER physician is taking a look at the EKG, confirming whether she's having a heart attack, and it looks like she is. The ER physician will take a quick history and physical, ask her about her pain, how bad it is, and how long she's been having it. We want to help her control that pain by giving her some pain medication. We're also going to start her on certain medication, blood thinners intravenously, as well as certain heart medication like the beta blockers. We want to make sure that she receives aspirin. And we're also continuously monitoring her heart rate, blood pressure, and how well she's breathing through this whole process.
Take some breaths now. Okay. Hang on, I'm going to call your cardiologist. You're breathing great.
Here comes the interventional cardiologist and cath team now, and it has been 15 minutes.
You guys up? Good morning.
Here we go. We're gonna go on 3. Everybody ready? 1, 2, 3.
Smooth.
Thank you. So we're gonna work quick here, okay? We're gonna get that artery opened up. So we're gonna put these arm marks through your arms.
How are you, Mrs. Stedman?
I've been better, thank you.
We'll take good care of you, okay? You're in good hands.
Hey.
Okay, we're gonna put these little patches on. We're gonna hook up your EKG. Oh, this is important. So we're gonna get you warm as well, okay? That's most important.
I'm cold.
Just get you. We just want to get you comfortable, and we want to get the doctor in as soon as possible. Okay?
So, what are the plans?
Well, we already know what's going on. I know the artery on the bottom of the heart is probably blocked, so I've already told our team here what equipment we need, what kind of wires, what kind of balloons, what kind of catheters, and they're all coordinated. They know exactly what I'm going to be doing. And how much time has passed already, Liz?
We're at 30 minutes. We're doing great on time.
So we're really doing really well. So our team is they're very specialized. Megan is going to be running our monitor. She's going to tell me exactly what's happening with the heart rhythm all the time and the blood pressure. Kerwin's our nurse. She's going to be giving all the medications that I need, blood thinners, pain medications. Renee is going to be scrubbing in with me. She's going to give me the proper wires and help me manipulate the catheters. Chris is going to be running the monitor here and the x-ray equipment. It's very important to get the right views of these arteries, and everything's going to be done very quickly now. And time is of the essence right now. So we're going to be putting in these catheters, and we already know what we're going to be doing. Renee's going to be helping me here. And we have the whole plan. If you notice, there's been a lot of redundancy. We've asked her a number of times about her pain. We know about her risk factors, so we don't leave anything to chance. We're going to make sure everything goes perfect for her. It seems like we're doing asking her a lot of things multiple times, but it's important to do that so we have no chance of any mistakes. So now we have the catheters in, and we're going to be taking the pictures and then fixing the artery. So this is an angiogram, which is the actual picture of Carol's artery. This is the catheter, and this is the dye going through the artery. And if you look on the heart model, this is the right artery supplying the bottom of the heart, and hers is blocked right around here. We can see the artery on the right is blocked. We're going to get a wire to put across that now, and then a balloon, and then a stent. So this is a stent that's collapsed on a balloon, and this is what we thread into that artery. Once I have it positioned into the artery, I expand the balloon, and this stent will expand like a little coil, like a spring on a ballpoint pen, and will get embedded into the lining of the artery to scaffold it open. We took this picture about 34 minutes since entering the door. We'll see we're going to put a wire down here. A wire goes through this catheter into the artery, and this is what a balloon looks like when it's expanded. You can see the wire in this artery. And once the balloon goes through, that'll be our door to balloon time, and hopefully we'll do that in the next 10 or 15 minutes. And this is the balloon expanding, and this was our door to balloon time. We opened the artery within 47 minutes. Our goal, remember, was 90 minutes. And then we take more pictures, and we can see this is a huge artery, supplies the whole bottom of the heart. And now we can see this dark stuff is the blood going down further and further. The arteries open more. You can see it's getting plenty of blood. And usually it looks like the rhythm's been stable. She's not having any more chest pain. EKG is looking better. And now I'm putting a stent in there. A stent's like a little coil, looks like the spring on a pen, which will keep the artery open. Now we don't leave the balloon in there, so we have to now collapse the balloon. And now we have the stent, and the stent is now a loose coil that stays inside the artery. And as I do this, I put two stents right next to each other because it's a very big artery. And you can see it's a huge segment, supplies a lot of heart muscle, almost half of her heart. Extremely important to get this artery open quickly and restore blood flow since it supplied so much heart muscle. Okay, so our door to balloon time was 47 minutes. The artery looks great now. The stents are in. We're all done. She's going to go back to the intensive care unit, and she should do very, very well. Thank you, everybody. Good job. That was a great video. So how are you feeling now? Are those symptoms resolved?
They are. However, I have rehab 3 days a week, so that helps a lot, I think.
Cardiac rehab.
You betcha.
And how does it help you?
Well, I feel my body seems not so tired as it did when I was staying home and not doing any exercise.
It makes you start thinking about being well again.
Yeah.
That you're back to normal. That
Exactly.
You're going to live a normal life.
Yeah, I'm going to be 75 next week, and I'm feeling 74 3/4. So.
Okay. And you probably have another 75 years to go now.
Wouldn't that be great?
That would be great. So that's the beauty. The idea these days is to get you back to a normal life, not to make you a cardiac cripple, but to get you back living the normal life that you always wanted to live. And I know you watch your diet now.
Yes, I do.
And you don't smoke?
Oh, no, I quit smoking in 1997.
And we're keeping an eye on your cholesterol and your blood pressure. But a lot of it is up to you. I've done my part. The hospital did their part. Our nurses and technicians did their part. One thing we like to say, though, you drove yourself to the emergency room because you didn't know you were having a heart attack. But people who think they're having a heart attack, they're best to take an aspirin at home, call 911 and have the ambulance bring you in, because they can do an EKG in the ambulance and get this whole process done faster and safer. But you had a great outcome. It was a great experience for us and for you, because our job is to save lives and get you back to a normal life.
You did a great job, and I appreciate it.
And we appreciate you coming on the show.
Thank you.
Thank you so much.